Good afternoon and welcome. I am Holly Wimsat, and I have the privilege of serving as the Director of the Bureau of Disability Services. We are glad you were able to share some of your afternoon with us. We, as always, are starting this presentation with our core value that all people are empowered to live, love, work, learn, play, and pursue their dreams. So this is the monthly provider webinar for case managers and providers. And we have Richard, has our Director of Provider Services, has put some links in the Q&A for your reference. So please check that out. Before we get started, if you want to turn on live captions, select captions, subtitles on in your video controls. To change the caption language, select settings, then caption subtitles and choose the language you prefer. So as a reminder, we are working to respond to questions resulting from these monthly webinars, as well as any trending questions that we receive. So we have increased some time in these webinars devoted to answering those questions. We'll continue to address case-specific concerns outside of the webinars. If you have questions, you may submit them to the bds.help@fssa.in.gov. All right, so today our agenda looks very similar to previous agendas. We're going to do an update for all providers and an update for the health and wellness and traumatic brain injury waiver providers. And when I say providers, that's inclusive of case managers. Updates for the community integration, rehabilitation, and family supports waiver providers and case managers. Some trending questions, and then our usual invitation for you to tell us some future webinar topics that you would like us to cover. So we will start with updates for providers and case managers that work with all of our home and community-based service waivers. So that's all four: the community integration and rehabilitation, family support, health and wellness, and traumatic brain injury waivers. And the first update we have is that we are very proud to announce a new chapter in how Indiana supports older adults and their caregivers across Indiana. The Division of Aging is now the Bureau of Better Aging and will be structured within the new Division of Disability, Aging, and Rehabilitative Services, or DDARS, under the Family and Social Services Administration, or FSSA. This new structure reflects FSSA's renewed commitment to ensuring that every Hoosier can age with dignity, connection, and purpose. So the Division of Disability, Aging, and Rehabilitative Services, or DDARS, will house four bureaus: the Bureau of Child Development Services, often referred to as First Steps, the Bureau of Disability Services, the Bureau of Better Aging, and then the Bureau of Rehabilitation Services. So now with BBA as a part of DDARS, BBA will benefit from some streamlined resources and a strong infrastructure to support individuals across the lifespan. So we're very excited to welcome BBA. All existing services and supports for older adults will continue without interruption. Nothing is changing there. This change in terms of Division of Aging becoming BBA and DDRS becoming DDARS does not affect eligibility, access, or the quality of programs that our Hoosiers have come to rely on. You can continue to expect the same trusted supports from the local area agencies on aging and other service providers. So we have been asked why the name change, and the reason is that we believe the Bureau for Better Aging as a name reflects our forward-thinking vision, one that embraces innovation, holistic well-being, and inclusive community living. So by joining the work of these divisions, we are creating more integrated systems that better serve people's changing needs as they age while preserving, what's working well today. So we look forward to continuing our work together to make Indiana a place where everyone can thrive at every stage of life. All right. You may have heard about some waiver amendments that we're intending to submit to our federal partners at CMS, but the public comment period for the December 2025 waiver amendments for the community integration habilitation, the family supports, health and wellness, and traumatic brain injury waivers has closed. So that public comment period is over. We in BEADS are reviewing the comments received, and interested parties will be able to review comments and responses once the review is completed and the waiver amendments have been submitted to CMS for review. If you have questions, you can email bds.help@fssa.in.gov. The planned implementation date for this set of amendments is December 31st, 2025. We have received some questions about provider or resources for providers. So we want to talk a little bit about that today. So BEADS understands that it can sometimes be confusing knowing where to go for help, or where to go to get questions answered or receive technical assistance. So we've included today some resources and a place to start for at least some basic information about BEADS provider. Being a BEADS provider. So for adding services, counties, and locations, for the health and wellness and traumatic brain injury waivers, entities should start with the OMPP provider certification portal. And we have a link here that's ompproviders.fssa.in.gov/provider enrollment application /s/. For the community integration habilitation or family supports waiver, the process is self-directed and can be completed in the BEADS portal. For those requests requiring licenses, proof of certifications, or other documentation, we ask that providers email the applicable support materials to BDS, Provider Services, at fssa.in.gov. For policy, procedure, waiver amendments, or updates, or statutory guidance, please contact bds.help@fssa.in.gov, and we're happy to answer your questions. For individual specific supports, if there is a needed resource there, we encourage you to, as a provider, to work with the individual's case manager, the IST individualized support team, or the applicable district office for BEADS district office. For technical issues or billing concerns, those are best addressed by submitting a JIRA ticket, and we have included the link here on how to do that. If you need additional instruction on how to use or access JIRA, you can send an email to the bds.help email address. For BEADS portal or Health and Wellness TBI, address, phone, contact updates, provider webinar, BEADS leadership training, or A&B training, and other general provider inquiries, please just contact us via the BDS provider services at fssa.in.gov, and we'll get back with you as soon as possible. An update here. So we occasionally, for a variety of reasons, sometimes have to move one of our field offices. So our field office in Muncie, which is the BEADS District 6, has moved to a new location as of August 15th. So they're getting settled in. And we are in that office co-located with areas 11 and 12 of vocational rehab. And that office is now located at 3413 West Fox Ridge Lane in Muncie, zip 47304. The phone numbers are the same. They did not change. We brought our phone numbers with us. The phone for that Muncie office is 765-288-6516, and toll free is 877 218-3531. All right. I want to talk some about incident reporting follow-up. So as we know, there are some incident reports that are completed that require a follow-up. So we want to just talk a little bit about those follow-up reports. So the case manager is responsible for submitting the follow-up report, but it is also the responsibility of the individual's entire support team to ensure that the team is thoroughly addressing the person's needs and responding to all requests for information on the incident report or the incident report follow-up. To ensure timely resolution, responses must be specific, complete, and directly aligned with the follow-up questions. Vague or insufficient answers often result in delays, as incident reviewers must request additional clarification before closing the report. So by providing detailed and clear, well-organized information in both the initial incident report and any subsequent follow-ups, teams can help streamline the review process. And this, anytime we can streamline, that makes us more efficient and leads to a faster closure and improved outcomes for the individual. All right, we're going to switch now to provider and case manager updates for the health and wellness and traumatic brain injury providers and case managers. All right, some reminders about service plans. So please remember to use start and stop dates when adding or adjusting services. This will help clearly show when a provider has ended and a new one is beginning. If the caregiver is a paid family caregiver, please make sure you confirm this information is entered when completing the service plan. And I'm talking directly to case managers now. Structured family caregiving will not allow you to enter an LRI or legally responsible individual as the paid family caregiver. So case managers, this can be documented in your quarterly team meeting notes, and that's where we would look for that information. Please be sure to enter comments when submitting the service plan so that the reviewer of the service plan knows what is being requested, any changes, and the reason for the change. This is also where a case manager can provide detail on non-waiver supports. Maybe that's school, maybe that's employment, that may be state plan supports, or it may be supports provided by informal entities or natural supports. All right, so want to provide a little bit of some brief information about submitting requests for authorizations. So we know the BEADS portal is new to case managers on health and wellness and traumatic brain injury waivers. We also know that that functionality just moved to the BEADS portal on July 1st, and we are continuing to work through and refine some of the data and functionality as we stabilize that system. But wanted to take a couple minutes because the RFA, or request for authorization process, is different in the portal than it was in the previous system, CAM. So just wanted to walk through a little bit. So in the BEADS portal, the RFA requests are submitted through a different process than it was in CAMS. To submit a new RFA, the case manager will navigate to the individual's active service plan and select RFA request in the left navigation. And that's shown here on your screen. From there, the case manager will select the type of RFA that is being requested. Then case managers can monitor RFAs and their status or the process for RFAs. You can navigate to the PCISP tab and then scroll down to the RFA request grid. Again, the portal is based on grids. So that's how case managers and BEAD staff organize their work, right? Is by those grids. This will show you all of your RFA requests and the status that they're in. This is also where those RFAs migrated from CAMS should be. Now, we know we've had some challenges with the RFA data that came over from CAMS and are working to address those. But that grid, that RFA request grid, is where you're going to find your activities as case manager related to individuals on your caseload with RFAs. All right, waiting list and invitations for the health and wellness waiver. So waiting list placement can be confirmed using the online portal at this email address. Very easy to use. Strongly encourage you to bookmark it if you work with individuals and families who may be on a wait list awaiting services. General invitation information is also available on our website. I'm not going to read the site to you, but we will have this in the slides. And then general questions can be directed to Medicaid at fssa.in.gov. BEADS specific questions can be directed to the beads.help email address. It is worth noting that we have temporarily paused resending of invitations while we, again, continue some refinement to the IT system following the consolidation of that functionality. The traumatic brain injury waiver waiting list. So we announced on August 20th that we needed to implement a waiting list for individuals seeking access to services via the traumatic brain injury waiver. This waiver has reached its capacity as determined by our waiver application, which has been approved by the Centers for Medicare and Medicaid Services, or CMS. Individuals currently receiving services through the TBI waiver will not be affected. So this is not impacting anyone already on the waiver. Beginning August 20th, or we began August 20th, individuals seeking to access the TBI waiver will be placed on a wait list. As of August 20th, individuals who are not fully approved with an active service plan on the TBI waiver will be issued a notice indicating they must be active within 180 days, or the invitation to the TBI waiver will be rescinded. So that is consistent with our other health and wellness waiver as well. If you have additional questions, you can send them to bds.help@fssa.in.gov. We have another reminder here. If you are needing a service plan to be expedited for review due to loss of service or health and safety concerns, we ask that you email beads.help@fssa.in.gov, and we will work diligently to address that. If you are having a technical issue impacting operations, we need you to submit a JIRA ticket. The JIRA tickets are important because they help us track and trend technical issues, and help us determine if there is a kind of a one-off kind of issue, or if there is some more system-wide or providers specific issue. So that is the reason we ask and utilize the JIRA system, is really for tracking purposes, and so that we can, analyze that data and trend it. All right, Level of Care Assessment Representative, or LCAR update. So you may recall on July 1st, we went live with LCAR, the Level of Care Assessment Representative, which is a statewide entity that completes nursing facility level of care assessments, reassessments, and determinations. So the vendor, the LCAR vendor, is Maximus, and they began doing those nursing facility level of care assessments for individuals seeking home and community-based services waivers on July 1st. They are continuing work on June, July, and August waiting list invites. They are working through some expired levels of care for some individuals on health and wellness, traumatic brain injury, and the Indiana Pathways for Aging waivers. And they're also, of course, working on new referrals from the area agencies on aging that they were unable to process prior to July 1st, right? So someone maybe contacted the area agency on aging on June 30th or June 2nd or 22nd, and the area agency on aging was able to schedule that assessment. Those were passed over to Maximus on July 1 so that they could complete those assessments. So lots happening, lots of assessments happening. We do ask for active health and wellness and traumatic brain injury waiver individuals who have either an expired level of care or an expiring level of care. We ask that you do not direct families to call Maximus. They have the information and will reach out to them. If a family is anxious about it and you're the case manager, you are welcome to send a note to Beads Help, and we can take a look at it. But just know there's no need for individuals and families to call Maximus about scheduling their annual reassessment. Maximus will reach out to them to schedule that. As a case manager, and actually as a provider as well, you can help support individuals and families with this new process with a statewide vendor completing those level of care assessments. You can support those individuals and families in a couple different ways. One, remind them that someone's going to reach out to them. Someone's going to call them, mail them a letter, maybe both, to say, hey, we need to complete your annual level of care reassessment. Let them know that's okay. That's the way it's supposed to work, and support them in getting that call returned and getting that assessment scheduled. This is a new process as of July 1 for individuals receiving home and community-based service waivers. So again, as a case manager, as a provider, anything you can do to support that individual and family through this transitional period is appreciated. All right, now we have some provider and case manager updates for case managers and providers on the Community Integration Rehabilitation and Family Supports waiver. We're going to start by talking about short-term budget requests. So short-term budget requests are intended to be short-term. typically 6 months or less, hence the term short-term. If an individual has had more than 6 months of consecutive short-term budget requests, or STBRs, and the individualized support team, or IST, has not demonstrated efforts to mitigate or eliminate the need for subsequent STBRs, future STBRs may be denied. STBR responses must be as detailed as possible and not be copied and pasted from one month to the next. We have talked about STBRs before, and want to note or remind that the case manager and case management supervisor or case management supervisor is responsible for ensuring all the information is correct prior to submission to central office. This includes when an STBR or a long-term budget request, LTBR, is submitted by the case management organization or to the case management organization by the provider. So for our friends that work in the health and wellness and traumatic brain injury waivers, this may sound a little bit like Greek, but what we're talking about are a short-term budget request is a short-term request for an increase in funding on the CIH waiver based on a short-term situation. And in the BEADS portal today, a provider is able to initiate an STBR. And then the case manager must go in and review that and ensure everything is, as all the information is there that is necessary before submitting to the state for review. What's important here is that in those, if there is a need for an STBR for an individual, that team, that the individualized support team, or IST, should be regularly discussing how to support an individual within their available resources, okay, or without additional funding. The IST discussions need to be circled around what if an STBR wasn't available or isn't approved. How is that team going to support that individual? So those are conversations that really need to be happening. BEADS expects the team to communicate its efforts to mitigate or eliminate the need for future STBRs. We look for that in the STBRs that we review. So it's very important that the team be having those discussions of how to support that individual. So the most common short-term budget request we receive at BEADS is for one-to-one staffing. And we want to talk a little bit about that to ensure that we're aligned about the one-to-one staffing. So we all should be very familiar with the Home and Community-Based Services Settings Rule. And that HCBS rule clearly indicates that restrictions must be the last resort. One-to-one staffing with an individual is a restriction. It very much is. So the IST must clearly communicate in the STBR responses what it has attempted, maybe what hasn't been attempted yet, or what's been attempted and maybe been unsuccessful prior to requesting the one-to-one staffing. We also need the IST to be able to provide appropriate data to support the need, as well as identify how to address potential lack of staff if an individual has one-to-one staffing. So those are things that we look for when we receive an STBR, particularly when an STBR is requesting one-to-one staffing. So we wanted to include some additional information. So below, or what I'm going to go through are a few reasons, which are not all inclusive, with proposed questions or considerations that the team, the IST, should address before submitting an STBR. So let's say there is no potential housemates or no candidates for a meet and greet. The case manager continues to review the case management organization housemate search tool when available. So some of the things for the IST to address would be, when did the individual lose their housemate? What other steps has the team taken to identify a potential housemate or housemates? When was the last meet and greet with a potential housemate? And what was that outcome? Are there any future meet and greets scheduled? And then what are the barriers to locating potential housemates, if there are barriers? And what action steps is the team taking to identify potential housemates? So those are some of the considerations and some of the questions to think about, and teams to discuss prior to submitting a short-term budget request. Those conversations can really support teams in effective problem solving. Let's say the individual wants to live alone. So the home and community-based Medicaid waivers are based on needs, not wants, right? The services should be provided based on assessed need, both in the type of service and the level of service. The individual must live within their means, and if the budget does not support living alone, for example, then other options have to be explored. Medicaid dollars can't fund someone's choice to live alone indefinitely. So something to think about when an individual wants to live alone is the team, the IST, reviewing other options? Employment, other home and community-based services, waiver services, housing with lower rent, for example. If the team is not exploring all that, we would want to know why not. All right. Provider and or legal guardian want one-to-one staffing, but individual does not. So a lot of us have run into this in the past. And sometimes these are difficult conversations to have. But what we would look for is, how is the case manager initiating those difficult conversations about what the individual wants versus maybe a perceived need on the part of the legal guardian or the provider? Have remote supports been explored? What are some of those options that have been explored? All right, another one, individual unable to contact help in the event of an emergency. So this is another reason that we see in STBRs. And some of the things we would look for, right, is how is the team educating the individual so that they're gaining some skills on how to contact help or be prepared. What is happening in that realm? Are fire or tornado drills practiced regularly? Can the individual dial 911? Or has there been training with the individual and education with the individual about dialing 911? Can the individual safely go to a neighbor's house? Are remote supports an option? They're a really great option for some. If it's not for this individual, then we would look for a clear explanation as to why. And then sometimes we've seen individual does not like to be alone and or has anxiety. So some of the questions we may think about is, how is the team supporting the individual in reducing anxiety? Has the team attempted short periods of the individual being alone to determine how he or she manages it? If anxiety is due to the individual living in a perceived unsafe area, has the team discussed the individual moving to another location where he or she feels safe. Is the IST exploring housemates? How is the individual being integrated with opportunities outside the home, which may help? So these are some things we would look at and ask teams to consider prior to submitting an STBR, and to share that, those conversations with us. I do want to note, we do see in STBRs that individuals do not like to be alone. And I think this is a great opportunity to note that not wanting to be alone does not mean people have to have paid services. We should be working with individuals in building up their network, those informal supports, right? If the person doesn't like to be alone, let's help connect them with peers with similar interests, or people in their local community that have similar interests, so that they have some connections, right? Community inclusion is a cornerstone of home and community-based services. And we need to support individuals in ways that are inclusive of their community, so that they can not just engage in their community or be in their community, but actually be a part of their community, to receive or to engage in informal supports, but also to provide support to others, those reciprocal relationships, right? That adds meaning to all of our days. So as we think about that, I do want to note that we continue to, at BEADS, do a lot of requests for more information on STBRs because of the lack of detailed information or required documentation. And as you all know, the more RFIs we have to do, whether we're talking about RFIs on STBRs or service plans or anything, that delays decisions, right? And outcomes for decisions to be shared with the individual. So we're hopeful that some of this information, that you will use this as you're working on STBRs and submitting STBRs, and that we can reduce the number of requests for more information we have to do, and that you have to receive and respond to. We really do want to streamline this process, but in order to do so, we have to have the information necessary to make an informed decision. So we appreciate your support in being thorough in including a complete picture of the individual and their situation on that first submission. Some other areas for improvement in the budget request process. We can move to the next slide, please. It's extremely important that supporting documentation is included with each STBR. And again, we look to the case manager, case management supervisor to ensure that supporting documentation is included prior to submitting that STBR to BEADS. We ask that teams ensure the requested units and hours are correctly calculated. So for example, if the request is for 24-hour staffing and the requested amount is over 24 hours per day, that wasn't correctly calculated. So please be sure to check that. And education is important for individuals and families that we support, right? So all alternative options should be discussed and documented. That includes less restrictive measures. That might be remote supports, it might be alone time, it might be services through another entity, might be natural supports. But at the end of the day, we need teams need to look at what the individual has in terms of available resources on the waiver as they're doing service planning. And sometimes that means some challenging conversations with individuals, guardians, and providers may be necessary. So, again, we look and we'll continue to look at those short-term budget requests and even long-term budget requests to see what the need of the individual is, what the level of need is, and what the team is doing to address the need outside of potentially asking for additional funding. So while past behaviors can be included in an STBR for historical context, STBRs are for a specific time period. So just want to note that as well. The case manager should not front load service units on the PCISP and then come back and request additional funding. Each STBR must provide a detailed plan of action moving forward. So if the STBR is requested due to loss of housemate, for example, we are going to ask about that housemate search. What is the status of the housemate search? And we might ask about home health services through Medicaid prior authorization or Medicaid PA. We might ask about alone time in remote supports if that's been considered, or ask about employment. We want this process, again, to be streamlined. So we may ask about those things, but you can be proactive, providers and case managers, when submitting an STBR and include that information on that initial submission. That would be very helpful. All right. Can we go back to that other slide for a moment, Richard, please? I do need to include a little more information about the front loading service units. Let me talk through an example. So if an individual has a residential HAB, let's just say the residential HAB RH2O, right? And the case manager front loads that PCISP and uses up essentially the allocation in the first 9 months of the plan year for that individual. There is no guarantee that an STBR will be approved for that remaining time period. So there is some risk for the individual in front loading those plans in that way. So that is why we recommend do not front load PCISPs and the services, because that can lead to or impact the person's ability to access services towards the end of that plan year. Thank you, Richard. Some reminders around the living arrangement changes. So we continue to receive JIRA tickets requesting changes to living arrangements because they were not entered in a timely manner. So the case manager can backdate a living arrangement 10 business days. Requests made beyond 10 business days will not be approved. So once a living arrangement changes, the case manager must enter the correct living arrangement. If the provider has not informed the case manager about a change, the living arrangement will not be backdated to the date of the change if it's been more than 10 business days. Case managers should also not update a living arrangement before the change occurs. And it's important to note here that both the case manager and the provider are responsible for monitoring the living arrangement and ensuring its accuracy. Inaccurate living arrangements could result in recoupment of claims that were inappropriately paid. All right. I am convinced we talk about this in every webinar. So provider attestations. So again, this is that functionality in the BEADS portal that we built in at provider request, where a provider can update their provider profile without having to email BEADS. So a provider system administrator is required to log into the BEADS portal and confirm the profile information for their agency at a minimum of every 90 days. This is for CIH and FS waiver providers. The provider profile should be updated anytime there's a change. And again, providers can do that independently. For assistance with completing the provider attestation, please refer to the BEADS portal user guide for the providers located in the resource section of the BEADS portal under user guides tab. Our percentages here are still very low, so we will continue to explore ways to encourage providers to complete these attestations. An application to add additional services. So we have seen in BEADS a significant increase in providers seeking to add additional services or counties to their services. According to 460 IEC 666, a provider seeking approval to provide additional supported living service or support shall, 1, have been surveyed within the preceding 12 months or as part of the approval process to provide additional services, have no outstanding complaints or issues that seriously endanger the health or safety of an individual. So if you want to, for providers should be prepared when adding services. Please don't forget that for BEADS providers to be eligible to add waiver services or counties, we ask that you submit evidence of your ability to provide the service to BDS provider services at fssa.in.gov. That includes providing all applicable licenses, services, and accreditations or letters of intent to survey for the service, and that will really speed up the review process. You must prove readiness to begin providing the service or service area immediately before being approved for the service or service area. All right, the Home and Community Support Professional Training and Registry. So many providers and home and community support professionals, or HCSPs, formerly known as direct support professionals or DSPs, have completed the training and registered. As a reminder, all HCSPs must be trained by January 1st of 2026. So please remember, if HCSPs are trained on a provider's current training platform, they will need to be retrained using the HCSP platform before January 1st, 2026. This could mean that applicable HCSP staff are taking 2 trainings prior to July 1st, 26. Their employers required training, and then this required HCSP training. Additionally, more information about the medication administration curriculum training will be provided shortly. For now, providers should continue using their existing medication administration training processes as required by current regulations. So a little more on the HCSP training and registry. An FAQ, or frequently asked questions, regarding the HCSP training program and registry has been added to the BEADS website under BDS resources. There's also a link to the HCSP training platform and training registry. You can access all 3 links by going to www.in.gov/FSSA/developmental-disability-services/. So you can access all of those links from that link. So some contacts for the HCSP training and registry. Support hours are Monday through Friday from 8 a.m. to 5 p.m. Eastern Standard Time. For HCSP training questions, we ask that you email hcsptraining@Syra Health, that's SYRAHEALTH.com. There is a live agent chat, so you click the chat icon at the bottom right corner of the training platform for immediate assistance. The training portal knowledge base is a Yes LMS. For HCSP specific help, search HCSP in the knowledge base. And for managers, please refer to your original group code and onboarding instructions email for guidance on getting learners onboarded and setting up your organization in the system. If you still need help, you can contact support@yeslms.com. And then for training portal technical issues, we ask that you email support@yeslms.com. So we envision at FSSA, we envision that all HCSPs who serve any population under home and community-based services waivers will have access to consistent core competency training. Applicable supports may include, but are not limited to, facilitating personal and household daily living chores, daily living activities, and accompaniment, as well as support to achieve identified goals, such as independence and community integration. So there is, the HCSP trainings would include direct support professionals and personal care attendants. So we are, again, very excited to roll out this training, and it is required by January 1st of 2026 for all HCSP in FS and CIH waivers. So we have seen a really good response. If we can slide to the next slide, or move to the next slide, please. We have 517 total registered groups already. We have 2,650 certified learners and a total users of 14,362. Now that is just as of August 12th. So that is really great response. We appreciate providers and HCSPs taking advantage of this training program, and we appreciate your partnership. So thank you for the great welcome for the training program. All right, some trending questions. First is, what is the name of the contractor assisting the state in developing, implementing, and managing the HCSP training and registry? So that contracted partner is Syra Health. They are a healthcare technology company powering better health in critical areas such as mental health, population health, and healthcare workforce. The company's leading edge technology and innovative services focus on prevention, access, and affordability. And you can learn more about Syra Health on their website at www.syrahealth.com. Can the HCSP registry be used as a hiring platform? And the answer to that is no. The registry provides a public profile of HCSP credential status, but it is not a hiring platform, and is not designed to be a hiring platform. Where do I submit information regarding my organization's accreditation? And this is someone with an organization that supports individuals on the CIH and FS waiver. Information regarding accreditation or provider re-verification, not to be confused with the Medicaid revalidation, which is a separate process, should be submitted to bds.reporting@fssa.in.gov, and then a member of the BEADS provider services team will review and respond. Next question is from Health and Wellness and TBI provider or case manager. We have received an email from an in-home vendor who also works with the other waivers asking us to assign a client to them in the BEADS portal how do we do this? So currently, the only providers who have access to the BEADS portal are those who provide services under the CIH and the Family Support Waiver. Health and wellness and traumatic brain injury waiver providers listed on an individual service authorization receive password-protected email links with the NOA's service authorizations and PCISPs, but do not have access to individual records within the portal. So case managers on the health and wellness and TBI waivers, if you receive contact from a provider and they need the SANOA or the PCISP sent to them again, please provide that to them. They are not able to get into the BEADS portal and get it themselves. An individual is on the FSW, but he lives in a home owned and rented from the provider. Is this considered a POCUS, which is a provider owned or controlled setting? And he requires an unannounced visit. So the short answer is yes, that is considered a provider owned and controlled setting. The revised definition of provider owned and controlled setting is inclusive of both that family support and CIH waiver if the residential setting meets the criteria in any one of the below bulleted categories, or the following bulleted categories, I should say. Next slide, please. A setting that is owned or co-owned by a provider of HCBS, a residential setting in which individuals who are not living in the family home and utilize ResHab and support level 2 or daily or structured family caregiving, a residential setting that is owned or co-owned by a provider of HCBS, and that same provider is paid to provide a variety of services bundled into a single rate at that location, a setting in which there are 3 or more units, apartments, or houses which are adjacent to each other, all of which are occupied by individuals receiving HCBS from the same HCBS provider. Or an individual's represented payee or guardian is not a family member and works for an HCBS residential services provider who provides services to the individual. All right. Next is our call for future webinar topics. Again, we know your time is valuable and we want this time to be helpful and productive for you. So if you have ideas for webinar topics, please email us at bdsproviderservices@fssa.in.gov. We would love to hear from you and hear about some things that you need to know or want to know more about. Again, we appreciate your time and your attention today. We hope that you have a great rest of your week. We do plan on doing another webinar next month, and we'll see you then. But if you have suggestions or ideas or items that you would like to see covered, please email BEADS Provider Services, and we will work to incorporate that, your request in a future webinar. We hope you have a great day, and we'll see you soon.